The results of a Wisconsin Department of Health investigation into safety concerns at UW Health came up clean this week.
It comes more than a month after the UW Health Nurses Union brought their complaints of understaffing and burnout to the DHS. Our Braden Ross got their reaction to the investigation's results. And Braden, how are they feeling about this?
Yeah, well, I talked to one UW Health nurse today who told me he was disappointed with the results of the DHS investigation, but the fight certainly isn't over.
My initial reaction is UW Health and DHS should trust nurses when they say they have grave concerns.
Just over a month after UW Health nurses brought their safety complaints to the Wisconsin Department of Health Services, the department's investigation into their reports came up empty.
They should trust nurses because we're the ones who are working directly at the bedside. We're the ones who hear our coworkers talk about how they're going to leave and then watch them go out the door.
The complaints stemmed from understaffing, turnover, and burnout UW nurses say is impacting patient care.
What I see right now is a lot of really heroic, passionate, and resilient young nurses, new nurses, but not a lot of experienced nurses and not a real plan to support and retain those nurses.
It's a problem UW nurse Colin Gillis says is industry-wide, but that's no excuse for UW Health in his eyes.
This problem is not unique to one hospital, but we at UW Nurses United, we want to lead the way in solving this problem that's nationwide and that's institutional.
The DHS's 3-day survey included reviewing thousands of hospital documents and interviewing dozens of staff members. It found no violations of hospital health requirements. UW Health responded to the findings in a statement reading in part, quote, "This reinforces what we already know to be true, that our quality and our culture of safety are part of the DNA of every single team member at UW Health." But Gillis says he and his colleagues aren't done fighting for better.
We're going to keep trying to work with the hospital administration as best we can. And meanwhile, we're going to keep doing the hard work that nursing at a world-class hospital requires.
Now, UW Health says it was disappointed that the nurses didn't first report their complaints internally, but the UW Nurses Union says they did make internal complaints before taking them to the DHS.